We're group number 1, and we're going to be talking about PASS and 10-meter walk test as our outcome measures.
The 10-meter walk outcome measure measures how fast a person can walk, which tells us about their functional mobility. The patient walks 10 meters and we time how long it takes to calculate their speed in meters per second. It's scored based off time or speed, with the faster speeds meaning better performance.
The 10-meter walk test is a highly reliable ICC measurement tool showing greater than 90% when it comes to current validity of gait speed. It has strong validity with other gait measures, which include the DGI and the FGA, which allows it to be paired with these tests to use for specificity and sensitivity. The MCD ranges particularly in general from 0.05 to 0.13. However, this varies greatly between the condition that person has. For example, this can range for someone with a stroke from 0.05 to 0.21, and that varies in itself depending on the type of stroke. For the MCID is the same, as it ranges starting off around usually 0.10 to 0.13. Again, however, this can vary greatly depending on the condition. And for example, for someone with a stroke, it can start around 0.16, and that depends as well on the type of stroke they have. In general, it varies a lot when it comes to the MCD and the MCID for the condition that the patient is dealing with.
The systemic review we use for our 10-meter walk test is the measurement properties of the usual and fast gait speed test in community-dwelling older adults, a consensus-based standard for the selection of health measurement instruments, based systematic review, which the reference is listed on this slide. 10-meter walk test can be performed by timing the full 10 meters or only the middle 6 meters using 2 meters acceleration and deceleration zone, with the full 10 meters typically producing slower speeds due to inclusion of start and stop phases. It may use a standing start or rolling start, with rolling starts minimizing acceleration and resulting in slightly faster speeds. Patients are instructed to walk at either a usual or fast pace, which are distinct conditions with different normative values and clinical interpretations. Outcomes can be reported as time seconds or gait speed meters over seconds, with gait speed most commonly used for its prognostic values and established cutoffs. Protocols also vary in the number of trials, 1 versus 2 to 3, and whether the best or average is used, as well as assistive devices are allowed, all of which can influence results. Overall, the 10-meter walk test is reliable and valid measure, but differences in protocol must be considered to ensure accurate interpretations and comparison.
The 10-meter walk test is one of the most well-regarded tests out there, as it is used across a multitude of different populations and health conditions. For populations, it can be used for those who are in their youth to the elderly. And when it comes to health conditions, when it comes to those who have a stroke, spinal cord injuries, Parkinson's, or multiple sclerosis, the 10-meter walk test is highly recommended for the settings that include acute care, inpatient rehab, outpatient rehab, and home rehab as well.
The postural assessment scale for stroke, aka the PASS outcome measure, is an outcome measure that measures postural control or balance in patients with strokes and looking at how well they can maintain or change positions, such in lying down, seated, and standing. It includes 12 tasks scored from 0 to 3, with the maximum score being 36. The higher score means better postural control and more independence long term.
Key psychometric properties for a stroke patient with impaired balance in relation to the PASS outcome measure. In a study by Lean and colleagues in 2024, the minimal important difference, or MID, for the PASS outcome measure was reported as 3.0. This means that an increase of 3 points reflects a clinically meaningful improvement in a patient's postural control. To put that in perspective, the PASS is scored from a 0 to 36 scale across 12 items, each which are rated from 0 to 3, and it assesses postural performance in lying, sitting, and standing positions. Additionally, Lean and colleagues reported a sensitivity of 81%, meaning the test is good at identifying patients who truly improved, and a specificity of 75.6%, meaning it can also reasonably identify those who do not show meaningful improvement. There's limited literature that focuses solely on the PASS outcome measure. Most of the variation in the research comes from how results are interpreted rather than the differences in scoring or administration. Overall, the PASS outcome measures appears to relate more strongly to function in the subacute and chronic stages of stroke compared to the acute stage. In a study by Estrada, Barranco, and colleagues in 2021, they examined the construct validity of the PASS outcome measure by comparing it to other established functional and gait outcome measures that can assess balance. In the acute phase, the PASS showed moderate relationships with measures like the Functional Ambulation Classification, Wisconsin Gait Scale, and Functional Independence Measure, and a stronger relationship with the Barthel Index. However, in the subacute stage and beyond to the chronic stage, the PASS demonstrated excellent validity across all these measures, and this strong relationship and correlation was maintained at the 6 to 12 months, which is the chronic stage. So overall, this suggests that the PASS is a valid tool for assessing balance in stroke patients, particularly in the subacute and chronic phases.
What recommendations for use in various practice settings exist for the different EDGE task forces? Acute care and emergency department. These measures must be timely and applicable for medically complex patients. It also suggests focusing on brief screening tools such as 5 times sit to stand. Inpatient rehabilitation, with these, it emphasizes measuring appropriateness for change during intensive therapy, including the Berg Balance Scale, the 10-meter walk test, and activity-specific balance confidence scale. With outpatient rehab and transitional living, this focuses on community integration and higher level function, using measures such as the functional gait assessment to determine where you go from there. Additionally, long-term acute care and skilled nursing facilities, with these measures, they're adopted to determine the functional health decline or if maintaining independence is even possible. And lastly, with home health, focus on safety and functional independence in the home and environment. This concludes what the recommendations for use in various practice settings exist for the different EDGE task forces.
These are our references that we use throughout this whole PowerPoint.